Hey everybody, I wanted to record a quick video about my heart ablation surgery. I know whenever I was looking into having it done, and shortly after I found out that I needed to have a heart ablation surgery, um, I went online and I wanted to check out some videos, and there was a couple that really helped me out. So I want to record this. I'm 35 years old and a very active person. So for me, finding out that I needed to have heart surgery was a little bit crazy. But when I was in high school, I did have SVTs. At the time, they put me on some beta blockers, but it really knocked me out. So we stopped taking those because I was able to control the SVT. Was able to take a deep breath and bear down and make it stop. So there wasn't as much concern there. They thought that maybe I would just I could grow out of it, and they would just play it by ear. So we decided not to go forward with any kind of surgery or anything like that. And I did kind of grow out of it. Recently, I was training for a mud race, an obstacle race, and was doing the insanity workout with a friend and started having SVTs again. I didn't panic because I knew what they were. I'd had them in the past, but I was a little annoyed with it. At first they were sporadic, and then they became almost regular. Almost every time I worked out or jogged or ran, I would have an SVT. They seem to trigger very quickly and very easily, and because of the adrenaline pumping through my body whenever I was working out, it made it much harder to stop them. So instead of a 2-minute SVT, I was having a 10-minute SVT with my heart rate around 200 or higher. So needless to say, I wanted to get that stopped. It wasn't a good thing that it was beating that high for that long. I started getting lightheaded, dizzy, and just had to sit it out for a little while. And usually once I calmed down, my heart rate would go back to normal. But we went to a specialist, a couple of different specialists. After I saw my cardiologist, they did a stress test. They were able to trigger an SVT. They weren't sure if it was SVT or if it was wide complex tachycardia. They weren't really sure, but they knew that I needed to have something done. So I did go to Dr. Duran, who is an electrophysiologist with Orlando Health Heart Institute. If you're anywhere in the United States, I recommend coming to Dr. Duran at the Orlando Health Heart Institute. He was fantastic. He knew what he was doing, very well educated, but I really liked him because he was able to sit down, as extremely talented and well educated as he was able to sit down and in regular layman terms say, hey, here's what is wrong with your heart. Here's what we're going to do to fix it. And it was very simple to understand. I was able to explain it to other people, and so it really set me at ease. And my wife felt a lot more comfortable with that as well. She was pretty nervous about the situation as well. The day of the surgery, I had surgery October 7th. Today's October 16th. The day of the surgery, we went in pretty early. They shave you, even if you're well trimmed, they'll kind of shave down there. I do suggest if you're a guy and you got a hairy chest, you definitely want to trim, because during surgery they're going to have stuff all over your chest and on your legs. So you might want to trim it kind of short, like you're a biker, because tearing the pads off sometimes can hurt. But anyway, trim up there. They're going to give you an IV, and after that, really your concerns are over. The most uncomfortable part of everything up until after the surgery was my IV site. It just didn't feel right, and so they'll prep you, get your IV. I got to talk to my family for a few minutes, and then they wheeled me in the operating room. The operating room was freezing. I remember, mainly because it was early in the morning. They had the AC cranked up in there for, I guess, it lowers the chances of infection, and the machines put off a lot of heat, so they keep it pretty cold. And I was in a gown, so I wasn't wearing much. So they lay me down. They prepped me. They talked me through everything, told me what they were going to do. and then they gave me some medication, and I felt great. I kind of went off into la la land. I don't remember them putting the catheters in my hips, in my groin area. That was the only thing I was really concerned about. Was, it's not a normal place to have a needle. So that was really going into it. That was my biggest concern, was that I would feel the catheters in my hips, and then it would creep me out, and I'd move or something. But I had 2 catheters on each side. I didn't feel any of it. I was pretty much out of it. I do remember during the surgery feeling my heart flutter. I remember feeling an SVT. They give you adrenaline to make your heart misbehave, so they say. They need to trigger the SVT so they can find out where the SVT or where the tachycardia is taking place. And so they were able to make my heart misbehave. They were able to locate it. Turned out I had a left posterior concealed track. Just means I had extra wiring in my heart. Most people were born with a certain set of wiring that helps your heart fire properly, and I had an extra wire. So they were able to locate it. They didn't have to poke any holes in my heart or anything else. They sent the catheter into my heart and ablated the proper spot. The whole surgery took about 2.5 hours. And the doctor told me that probably 2 hours of that was locating the spot, measuring the spot, and hitting it exactly where it needed to be done. I like Dr. Duran because he's pretty conservative. He's not going to overdo it and do extra if he doesn't need to. And so I like that about him. I do remember waking up a little bit towards the end. Like I said, I remember my heart fluttering. I remember towards the end looking over at the screen and seeing all the wires. I was pretty excited because I asked him if I could have a DVD recording of my surgery, and of course, they told me, yeah, sure, yeah, we'll get that for you. And later they told me, yeah, we can't do that. But they just didn't want to argue with me while I was medicated. So I do remember that. I remember them wheeling me up to my hospital room and removing the catheters. I didn't feel it. I think they had numbed me at that point also, so I did not feel them removing the catheters. I was awake for that, but they wouldn't let me watch. I couldn't move my head. I had to remain perfectly still for about 4 hours, but I was coming out of sedation anyway, so I kind of took a nap. I had a nurse there that made sure I didn't move. The day of the surgery, I was up walking around with my wife, walking around the hospital floor, and they sent me home the next day. The only thing I needed to watch for, they told me to not strain at all, because you do have very large arteries, the femoral artery running through your hip, and it had holes in it, so it needed to heal properly. So I wasn't allowed to lift anything or really strain at all for 7 days. But the whole reason that I got the surgery in the first place was because I was training for a race. And, in the back of my head, I knew I probably wouldn't be able to race, but I was kind of wondering if I could. And the doctor made me promise that I'd take a week off, and that if I did, that by the 19th, that I could run the race if I promised to take it very easy. So I am going to be running the race this Saturday. I am going to be taking it very easy. I'm definitely not going to participate at the level that I did last year when I ran it, but I got a running partner out of it. My wife is going to run it with me to keep me at her pace, and it's going to be a blast. So, guys, I haven't had any SVTs since. You don't have any nerve endings in your heart or arteries, so you're not going to feel anything. I did have a pretty colorful bruise that I still have on the right side of my groin. The left side healed up pretty easy, but you'll feel tender. It was a little sore for probably the first 3 days, 3-4 days. I couldn't walk much. I didn't go up and down the steps. So you're going to need to take it easy and rest. But yesterday was the 7-day mark, and I jogged. I went for a 1-mile jog. I didn't break any land speed records or anything, but it was great to get out. I can definitely tell that I haven't run in a while. I feel it, but I'm looking forward to getting back out there as quickly as possible. So if you were on the fence on whether or not to have surgery, do it. If you're anywhere near the Orlando area or you have means of getting here, come here to Orlando Heart Health Institute. They did a great job. And, you know, I know how much the videos helped me when I was thinking about doing the surgery. And my biggest concern was I would be stuck on medications for the rest of my life. I didn't want side effects. I didn't want to have to worry about that. And so the good thing about the surgery is you'll probably not have to take any medications, and you can go back to life as you used to, back to a normal life. And you know, I had a couple of ghost flutters where my heart it flutters a little bit. It's like a skip beat, and it feels like what it used to do just before an SVT, but it's not followed by an SVT. You know, it doesn't speed up or anything like that. So it's great to have gone for a jog, and my heart rate never went over 150, 160. Where in the past, halfway through my jog, it would go to 215, and I'd have to slow down. So it feels great. So, you know, I hope that relieves some of your nervousness. I know it's surgery; you're going to be nervous anyway. But hopefully, you know, me posting this video is going to help somebody out and help them make a decision on getting a surgery or not. So, good luck, guys. I hope everyone stays healthy, and God bless.